Hello, my name is Dr. Gauri Bede, and I'm a medical oncologist. I am starting this series to examine what supplements people commonly take, and today we are going to talk about fish oil. We are talking about fish oils because they contain essential fatty acids. What are fatty acids? They are mainly a chain of carbon atoms linked by hydrogen bonds and have a carboxyl ester at one end and a methyl ester at the other end. They are of varying lengths and have different saturation of their hydrogen bonds, which make them either saturated or unsaturated. Saturated fatty acids are the bad kind of fatty acids. They are mainly found in solid fats like butter, lard, solid coconut oil, in meats, and they've been implicated in leading to heart disease with high LDL cholesterol levels, and they are the ones to eliminate as much as possible in your diet. Unsaturated fatty acids are the ones that we prefer, and these can be either monounsaturated or polyunsaturated, depending on how many unsaturated hydrogen bonds there are in that chain of carbon atoms that we first saw. What do fatty acids do? They are very important in our life processes. They're an integral part of the cell membrane, which is made up of lipids, and they control the influx and outflux of materials that are vital to life. They are very important in energy transfer as well as energy storage. So, we really cannot eliminate all fatty acids from our diet. Our body can manufacture a number of fatty acids from the building blocks that it already contains, but there are a number that cannot be manufactured and are essential for life, and these are called essential fatty acids. And these can be obtained from both plant and animal based diets, for example, vegetable oils, nuts, eggs, and fish. So, why do we recommend taking fish oil supplements? We know that in cardiovascular health, there have been many clinical studies which have shown their beneficial effect by decreasing triglyceride levels, improving hypertension, and they also have many other properties, including anti inflammatory properties. But the main reason is that the fish oil supplements contain omega 3 polyunsaturated fatty acids or PUFAs and mainly DHA and EPA, and these are only minimally produced in the human body and are quite beneficial in many circumstances. And that brings us to the heart of the matter. Do taking these supplements have an anti cancer effect? We do know now that cancer cells thrive in an inflammatory environment, and the omega 3 PUFAs have an anti inflammatory effect by interfering with several enzymes, mainly COX enzymes, and they increase the oxidative stress in cancer cells, which increases cancer cell death. There have been many animal experimental models which have established this, as well as tissue studies from human tumors and examining the effects on human cancer response rates as well as disease progression rates in cancer patients who have been given fish oil supplements. For example, in colon cancer, using fish oil supplements in various forms showed a decrease in the development of new colon polyps as well as a decrease in the risk of colon cancer. Other studies have shown that patients who were going through chemotherapy and radiation therapy for treatment of their esophageal cancer showed a significant decrease in their side effects, which would be soreness in the radiation sites or a decrease in their total white cell count, which would then have caused them infection. Other upper GI cancers, including pancreatic cancer, showed a benefit of increasing the appetite, increasing weight, and increasing quality of life scores. Patients who were being treated for stage 4 lung cancer were given fish oil supplements compared to a placebo. And the patients who were on fish oil supplements stayed on the treatment longer and had a longer survival rate. The same thing happened with stage 4 breast cancer patients who also had a longer survival, and this can depend on a variety of factors, both their dietary intake as well as the patient's own metabolism. And these studies still need to be performed as to how to optimally combine DHA and EPA with chemotherapy. So, how much should you take? The current recommendation is to get at least 2 grams of DHA or EPA combination every day. But you also have to limit the dietary intake of another PUFA, which is an omega 6 PUFA, because omega 6 PUFAs are actually inflammatory and they counteract the benefit of omega 3 PUFAs. These are found in most vegetable oils, nuts, and eggs. So it's finding a balance between eating foods and which are omega 3 PUFA rich but omega 6 PUFA poor. And that is where taking the supplement helps you rebalance your omega 6 intake by providing you with the omega 3 PUFAs. So, is there a downside to taking fish oil supplements? When you go for an operation, you will get the recommendation, or rather the instruction, to stop fish oil supplements for a certain number of days before you have surgery. And that is because the pathway by which fish oil acts against the inflammatory enzymes also can interfere with the platelet function, which means that the platelets may not adhere or stick together as well as they should in order to plug up any bleeding points. In actual fact, not much bleeding risk has been noted in clinical studies, but obviously, no surgeon wants to take that chance. And then the other risk has been that we are harvesting this fish oil from fish, and fish have taken up environmental pollutants, and there may be a higher concentration of heavy metals like mercury in their tissue. And the FDA has given a recommendation that up to 2 grams daily, these supplements are what would be regarded as generally regarded as safe, GRAS, and that applies to a lot of other nutritional supplements as well. So that is the recommendation from the FDA. So let me show you what I pulled out from our medicine cabinet. I have 2 big bottles, and there I don't have any brand recommendations, but basically what they do give you is the omega 3, and that's what really you're looking for. And they also have a little label which tells you that it's been examined for toxins, and the toxicity level is generally regarded as safe. So I have these bottles because my husband is much more diligent about taking them than I am. But having just gone through this literature for this post, I'm going to start being a little bit more diligent than I have been so far. So I hope you found this information useful. And I will be coming back periodically with other supplements. So do subscribe and join the conversation. As I've told you before, I also blog on my website, which is www.gauribhidemd.com, and I tweet at gauribhidemd. So thank you for visiting, and have a wonderful day.